What exactly is ADHD? ADHD, or attention deficit/hyperactivity disorder, is a neurobiological condition that affects one's ability to sustain attention. It's a common disorder in children, and its symptoms can persist into adolescence and adulthood, impacting various aspects of life from school to family and social settings. ADHD is more frequently diagnosed in boys than in girls. This is because boys typically exhibit the attention deficit type of ADHD, which is more recognizable than the hyperactivity type more common in girls. The ratio of boys to girls receiving an ADHD diagnosis is approximately 4:1 in the general population. Children and adolescents with ADHD often struggle with school attendance, social skills, and increased stress, which can lead to reduced productivity and limited professional skills. These difficulties can hinder their adaptation to the demands of adult life. Moreover, ADHD can strain relationships and impact self-esteem, personal health, and safety. It's important to remember that untreated ADHD can lead to significant functional deficits, affecting a child's self-esteem, personal health, and safety. But what causes ADHD? This is a complex question with many misconceptions. ADHD is not an indicator of mental retardation, laziness, or deliberate misbehavior. It can coexist with individuals of any level of intelligence, psychopathology, and psychosocial status. It's not about a lack of attentional capacity, it's about being differently wired. Numerous theories aim to explain the causes of ADHD. One of the most substantial is the genetic correlation and biological basis for the disorder. It's been found that ADHD can be a familial trait. Children from parents who had ADHD in their own childhood have a high risk of meeting the diagnostic criteria for the disorder. The type of ADHD that persists into adulthood appears to have a greater genetic basis than the type that remits or stops in childhood. This suggests that ADHD is not just a phase. For many, it's a lifelong condition that requires understanding and management. ADHD is considered a neurobiological disorder associated with peculiarities in brain development, with dysfunctions in neurotransmission mainly through dopamine and norepinephrine playing a central role. Understanding these causes and debunking the myths is vital to supporting those with ADHD and those who care for them. So, what does the future hold for ADHD research and treatment? As we gaze into the horizon of ADHD research, a few promising areas come into focus. The current research landscape is dominated by a quest to understand the genetic and biological basis of ADHD. This quest is not merely academic, but it holds the key to unlocking new and improved treatment methods. Researchers are tirelessly working to decipher the genetic code of ADHD. Their goal? To identify the specific genes that contribute to the onset of this disorder. This knowledge could pave the way for personalized treatment plans tailored to an individual's genetic makeup. Parallel to genetic research, scientists are delving into the biological basis of ADHD. They're exploring how irregularities in brain development and neurotransmission, particularly involving dopamine and norepinephrine, play a part in this disorder. This research could lead to revolutionary therapies that target these specific neurological pathways, offering a more precise approach to treatment. Beyond the genetic and biological frontiers, there's an increasing emphasis on developing new treatment methods. These include not just medications, but also behavioral interventions and other therapies. For instance, cognitive behavioral therapy, mindfulness practices, and neurofeedback are being studied for their potential to manage ADHD symptoms. Early detection and intervention are another crucial area in the future of ADHD treatment. Recognizing the signs of ADHD as early as possible allows for prompt intervention, which can drastically improve outcomes. Future research will likely focus on refining diagnostic criteria and tools to facilitate this early detection. The road ahead in ADHD research and treatment is undoubtedly challenging, but equally exciting. Every breakthrough brings us a step closer to a future where ADHD is no longer a barrier to a fulfilling life, but a condition that can be effectively managed. While there is still much to learn about ADHD, advances in research and treatment provide hope for individuals and families affected by this disorder.